Okay, hello, my name is Jasmine, and today I'm going to be doing a head-to-toe postpartum assessment on a mother. Okay, so we're gonna head into the room. Knock, knock. Okay, I'm gonna put on hand hygiene and make sure I have gloves. All right. So, hello. My name is Jasmine. I'm gonna be your nurse today. And today we're going to be performing a postpartum assessment on you, okay? So before you do that, I'm going to ask for your name and date of birth. Okay, thank you so much. And I'm going to confirm with the armband, or the wristband, if that's correct. Okay, all right, thank you so much. So now we're gonna start the head-to-toe assessment, and just before I begin, I'm going to make sure I I'm going to provide privacy, and I'm going to come back here and just assess how she looks. Is she crying? Have I seen her interact with the baby recently? Has skin-to-skin contact been promoted, etc.? And she seems fine. She seems happy about the health of her baby, and I've seen them interact recently, so that's good. So her emotional state seems healthy. All right, so now I'm going to take her vitals, and I would take her temporal temperature, and it should be between 98.6 to 100.3. And now we're going to listen to her heart for a full minute, and we should hear 60 to 100 beats per minute. And then now I'm also going to, I would take that for a full minute. And now we're going to take her respirations for a full minute, and that should be 12 to 20 respirations per minute, okay? And I would also take her blood pressure, and her blood pressure should be baseline with, her blood pressure should be whatever was her baseline in the first trimester. So, all right. Now that, and now I'm gonna ask her, are you feeling any pain? No? Okay, that's good, because we want to be within the 0 to 2 range. All right, so now we're gonna move down to the breast. Okay, so I'm gonna note, first we're just gonna look, we're gonna see if there's any signs of ecchymosis, if there's any bruising, any redness, any swelling. We're gonna see if the nipples are inverted, everted, or flat, and they seem everted. We're going to see if she's been having any pain, and then we're also going to gently touch here, press with the back of my hand to assess fullness and firmness, and they're both full and they're both firm, which is good, and they're consistent. All right, so now is it okay if I lift up your gown? Okay, thank you. I'm going to move on to the stomach area, and we're going to assess the fundus. So I'm going to first look to see if everything's looking okay, and we're going to use 2 hands, one to support and one to palpate. We're going to palpate down to see if we can feel the fundus, if it's present, if it's midline, if it's firm, because we don't want it to be boggy, okay? So now we're going to move on to the abdomen. So I'm going to auscultate all 4 quadrants of the abdomen to see if bowel tones are present. 2, 3, 4, and they were present in all 4. Okay. So, and now we're going to just assess her bladder, see if it's distended or if it's full, and ask her when the last time she urinated was. An hour ago? Okay, good. And she should be releasing over 30 cc's per hour. All right. So we're going to move on to the vagina now. So we're going to assess the configuration. We're going to see if there's any redness, swelling, lacerations, if there's any drainage, especially if she had an incision, so an episiotomy or a C-section. We're going to then note the lochia. We're gonna undo her pad, and we're gonna take a look at it. We're gonna see, we're gonna note the color, the odor. We're gonna note how much blood there is, and when the last time she changed the pad is, and if there's any clots present. So I'm gonna ask, when's the last time you changed your pad? Only 2 hours ago? Okay, that's good. So we see that the pad, there's not that much blood, and there are no clots that are bigger than golf balls. And please let us know if there are any clots bigger than golf balls, because that's not normal. Okay? All right, like I said, if she had a C-section or episiotomy, we'd look at the incision site, make sure the edges are well approximated. Note for any drainage, any signs of infection, swelling, redness, and I would also tell her that if she ever experiences any of these things, swelling, redness, irritation, or especially drainage, let us know. And if there's drainage, I'd note the color of the odor. So now we're gonna move on to the legs. All right, so I'm going to first look at the legs, see if there's any bruising, redness, swelling, if there's, and I'm gonna palpate the legs for signs of edema, okay? Oh, I also forgot to mention, I would also check the vagina for edema as well. And then now we're going to check for a DBT. By doing that, we're gonna lift the leg gently, we're gonna dorsiflex the foot and ask her if it hurts. Okay, it doesn't hurt, that's good. And now we're gonna check for clonus while we're here. Lift the foot, let the foot fall naturally, and it should not jitter. So I would be doing that to both legs. Okay, so now that we're done with that, I can move on to giving her a bit of discharge teaching or warning signs. So I checked your temperature earlier and it was within range, but if it ever exceeds 100.4, let us know. If you ever have a headache, shortness of breath, if you ever have thoughts of harming yourself or the baby, if you, I already mentioned if your clots are bigger than a golf ball, note for signs of infection at your incision sites, and then note for okay, we're gonna stop there, and then we're going to do some general discharge teaching as well, and one of them would be perineal care. Make sure you do thorough perineal care so that you don't get an infection, especially if you have, be mindful of your incision sites. Make sure to watch for signs of infection and make sure your incision sites are approximated, etc. And that they're clean and that there's always clean dressing on them. All right, so now after that, I'm going to go document, and we're gonna document what I found, date, time, and then ask her if she needs anything, and then we're good.
Good job.